I'm Joe Halco, Director of Community Relations for Northwestern Counseling and Support Services, and welcome to another episode of NCSS Here for You. We're coming to you from Northwest Access TV's beautiful new home with a state-of-the-art studio and production facilities. Each month on this program, we discuss a human services topic, and we do that with staff from one of our three service divisions. Our three service divisions are Behavioral Health Services, Children, Youth, and Family Services, and Developmental Services. This month's program is entitled the NCSS Integrative Medicine Clinic. Excitement continues to build as NCSS prepares to launch the Integrative Medicine Clinic. Integrative medicine seeks to restore and maintain health and wellness across a person's lifespan by understanding the patient's unique set of circumstances and addressing the full range of physical, emotional, mental, social, spiritual, and environmental influences that affect health. What does all of this mean, and why is it important in addressing population health? To discuss the NCSS Integrative Medicine Clinic in greater detail, I'm pleased to introduce this month's guest, Dr. David Mooney, NCSS Medical Director. Dr. Mooney, I'd like to welcome you to the program.
Thank you, Joe. It's nice to be here.
So, when will NCSS be opening the Integrative Medicine Clinic?
Well, tentatively, we'd like to open up around August 1st. This has been something I've been interested in for a couple of years now, at least. Basically, we want to give people an opportunity to join complementary medicine with their conventional medicine. That's what integrative medicine is all about. So, the reason that we want to do that is because I think as a psychiatrist over the years, I've started to step back and you start looking at, well, what have we done in psychiatry? Where are we at in psychiatry right now? I think it's important to look at that. And when I've done that, and I'm sure other people will agree, it's hard to say that we've made significant strides in psychiatry. Yes, we've done a really good job managing people. We've really helped a lot of people. I trained in a time when there was a huge boom in psychopharmacology. So it was a very exciting time because now we have all these medications. It was like a toolbox, sort of in a way. But it was a very exciting time because we said, oh, good, some hope. We have some nice drugs here that we can use, and there were also some other treatment modalities that were coming out too. But it was an exciting time, and it was like we were always just one prescription away from the perfect remedy. And we've used these medications, and now we're standing back, and I'm seeing patients that maybe they've been depressed 10, 15 years. Has their life changed that much? Not really. How many medications have we tried? 4, 5, 6, who knows what? And we're not getting what we want. And they're certainly not getting what they want. So we got to look for different things. So why is that? Why is it all these years we got all these scientists coming up with all these medications and stuff? And it's simply because I think we've been chasing symptoms and not the cause of illness. So what integrative medicine allows us to do is to start looking at things. Well, first of all, we do lots of metabolic labs. Because by looking at the blood, I call it looking under the hood. By looking at the blood, there's lots of things that can be detected, and we have lots of natural remedies nowadays. People are either for or against supplements. I hate to even use the word supplements because actually you're just kind of making up for what the system lacks. I also hate the term mental illness, by the way, because it's not like it's mental illness is a system gone awry. It's a combination of all different types of symptoms. So anyways, when we do integrative medicine, we like to check things like B12, folate. We're checking the thyroid. We're checking magnesium levels. We're checking all kinds of indices, all kinds of labs that, based on indices and levels, give us an idea of how we can help people out. It's very easy to do. And I think that more and more people are getting excited about that too.
So you've touched on some of the definition of integrative medicine, but how would you truly define it to
Yeah.
the layperson?
Yeah. So first of all, it's very person-centered, and you kind of touched on that in the introduction. It's not, James the schizophrenic or, Jane the borderline. We need to take the labels off. Now, that's very difficult to do. You think, well, what's so hard about that? It's a paradigm shift because that's the way we're used to practicing medicine. When I was a resident, they say, well, go see the schizophrenic in room 14. Okay, but that schizophrenic in room 14 has a life. He has a family. He lives in a community. There's a laundry list of things about that person that we need to know, not just that he's a schizophrenic. So we need to take the label off. What are their goals and desires? And frankly, James the schizophrenic, Jane the borderline. To be honest with you, I don't really care about the diagnosis. I know it sounds a little radical, a little out there, but really, that's not what I'm interested in. I'm interested in what brought them here. What can I help them with? I don't care if they're a schizophrenic or a borderline. What do we need to work on? You can call it what you want. Yeah, that makes no difference to me. So, 1, person-centered. 2, it's obviously integrative implies it's a very inclusive approach. So, there's an openness to evidence-based, and I want to stress that.
I think it's important.
More and more research in this area on evidence-based approaches with modalities and treatments that come under the category of complementary medicine, which would be what we all know what those are, acupuncture, massage, herbal medicine, mind-body medicine. And I want to stress, we don't have that stuff in our clinic right now. But what we do have is we'll be starting out with doing metabolic workups and getting, like I mentioned earlier, and really getting an idea of where people are at metabolically. Now, if people are interested in massage or acupuncture or chiropractic, we can talk about that. We can give them some ideas for some referrals because even though we don't have it in our clinic, we certainly can get that from the community, and that can be integrated into their treatment plan as well.
Absolutely.
So person-centered, inclusive approach, and probably the most important is the goal is not just to treat the disease, but to optimize vitality. It's not acceptable to just treat your depression and that's it. We've treated your depression, great, have a nice life. There's so much that goes along with that. We've treated your depression, maybe you're back to baseline, but let's treat your gut along with that. What has happened to your gut while you've been depressed? We have trillions of bacteria in our gut. And so there's, again, lots of research on probiotics, repairing that gut. So not only have we treated your depression, now we're going to help out with the gut. And we're going to get you back so you're vital. Along with that are the simple things. Where are you living? Do you have a job?
Sure.
It's not just all about medicine and just bringing back purpose and meaning in people's life. That's what gets people vital again. So it's not just about treating the illness. So those are the concepts, I would say.
Now, let's talk about the defining principles of integrative medicine.
Okay.
And what those are.
So firstly, it's a relationship. The patient and the practitioner are involved in a healing process. So it's a relationship. They're partners in that. Okay. All factors that influence health and wellness are taken into consideration. That means the mind, the body, the spirit, community, all those things are taken into consideration. And then obviously, again, we use both conventional and complementary medicines to facilitate healing. Interventions tend to be less invasive and more natural whenever possible. Integrative medicine doesn't reject conventional medicine by any means. And in fact, we want to, again, be a marriage with conventional medicine. And we also accept, alternative therapies uncritically, if they make sense. Very important, and this is true in all medicine, good medicine is based on good science. So we don't want to be recommending anything unless it makes sense and it's evidence-based. There's, I think in integrative medicine, there's a broader concept of health promotion and prevention. And lastly, something that I work on every day is that practitioners of integrative medicine should exemplify the principles of integrative medicine and commit themselves to that as well. And Hippocrates said, physician, heal thyself. So I have a part in this too. You know?
Absolutely.
So yeah, those are the defining principles, if you will.
Sure. And how does integrative medicine then differ from alternative medicine? You know, when we talk about that.
It's not as complicated as it sounds. So we all know what conventional medicine is, of course. By the way, I should say that approximately 30% of adults and 12% of children use healthcare approaches that are considered outside the mainstream of medicine, complementary medicine. Those are big numbers.
That is big.
Yeah, and that's growing all the time. So when these modalities are combined with, when complementary modalities are combined with conventional medicine, then that's considered complementary. If non-stream practice is non-stream practice being, people would consider integrative medicine to be non-mainstream practice sometimes. Okay. If you pair that with conventional medicine, then that's considered complementary medicine, okay? If non-mainstream practice is used in place of conventional medicine, an example of that might be, like Ayurvedic medicine maybe, which is Indian medicine. I'm not at all an expert in that, but based on Indian principles, Hindu principles, I believe is a whole different branch of Eastern medicine. That would be a considered alternative, okay?
Yeah.
So when they join together, then that's considered. Integrative is the combination of complementary and conventional. Yeah, that's better. I explained that better. There was a survey in 2012 of complementary health approaches, and they determined there that 18% of Americans are using supplements other than vitamins and minerals. And interestingly enough, fish oil seems to be the one that's out there the most, but it's out there and people are using it and they're getting results.
Yeah. And that's a pretty big percentage as well.
That is.
When you
Yep.
talk about.
That is. Yep.
So now what can someone expect when they seek care from the NCSS Integrative Medicine Clinic?
Well, the referral is pretty much the way that it works now, so along the same lines, but we have the advantage now of having integrative health clinicians in all the primary, not in all of it, in 15 spots, which is huge.
Sure
And
is.
these integrative health clinicians work with the primary care providers. They're working with the primary care providers with patients. Primary care provider might be able to refer a patient that they're seeing at that time. They're in the office together at that time to the integrative health clinician who might provide a little supportive counseling, might be able to direct them to some resources, things like that. They're very key and very important thing and wonderful thing that we've been able to do.
Yes.
And it's been hugely successful. They also will be a part of this because, for example, you might be seeing your primary care doctor who says, okay, I'd like you to go see Jane, our integrative health person, and you go meet with Jane, and Jane says, well, it sounds like you've been struggling with your depression for some time now. You know, the doctor told me you've been trying lots of medications. Here's a brochure about something that we're working on now in our clinic, and I wonder if any of these things would appeal to you. And so some referrals will be coming directly from there. Of course, there will be some people who are already in the clinic who say, this sounds like a modality I would like to do, and that, of course, is a very easy in-house referral. But basically, the referral process is like it always works. We do it with the primary care doctor. Primary care doctor would send in records. The patient would receive an admission packet with a bunch of questionnaires to fill out so that's reviewed before you get there, so that we would know who's coming, what some of the issues are, what we need to work on, and then you get scheduled. Once you're scheduled and you meet with me, typically initial evaluation can run anywhere from an hour to 2 hours. Patients can expect to be getting some lab work done, again, looking under the hood. And at that time, at that initial appointment, based on what some of their concerns were in the admission packet, what we're seeing, what we're talking about in the admission assessment, and also basically what they want to do, we'll throw together a treatment plan at that first meeting, a tentative treatment plan. What are we here? What are you here for? What do we need to work on? and set that up. I realize there's some people who are kind of skittish about getting blood drawn. That's okay. I don't want people thinking, well, you got to get your blood, you got to get your blood drawn. No, I mean, that's an important part, but it's not just all about that too. Yeah, so that's, oh, also, of course, we have clinicians in our own clinic who that would also be more than happy, I'm sure, to pick up some of these patients too. Again, we're still designing this program, so we're not 100% sure how that's going to work, but we have some very great clinicians that will be more than happy to follow some of these people coming through the integrative medicine clinic.
And I think just like any other program that NCSS has, I think the beauty of this is the fact that each and every situation is individual and unique, so that there is no cookie cutter approaches, or, because I think that's important. People understand that even though you're talking about the integrative aspects of this, that some people might think, well, that sounds good, but maybe everybody over here gets put in this group and everybody over here. And that's not true. It's that you're still dealing with an individualized plan depending on someone's circumstances.
Right. It goes back to the first concept. It's patient-centered, person-centered.
Person-centered.
Who are you? What do you want? What do you need? I don't care about everybody else. I don't even care about your diagnosis.
Right, but you're starting with the person and working with them alone, and like you say, anything else that's ancillary is really kind of out of bounds or irrelevant.
Right, we're designing a program for you based on your needs.
Now, since piloting this initiative at NCSS, what has surprised you the most?
It's taken off pretty well. Of course, I've only been, I used to work at, as you know, Joe.
Yes.
I've been at NCSS before, and actually my experiences before at NCSS were what brought me back. Because this was a wonderful place to work at then, it's a wonderful place to work now. And I should also add, I feel very fortunate that NCSS allows me to kind of pilot a project like this, because I really feel that NCS encourages people to come up with ideas, innovative ideas, and do things. And so that's great. But it's taken off pretty well. I see mostly kids, so I see lots of parents, mostly mothers, but I see mostly kids, probably 90% I see are kids. That kind of puts us in a different category in a way, not real, it's still integrative medicine, but we're talking about integrative approaches for kids. And frankly, most of those kids have ADHD, other diagnoses too. But so the good news is we have some very solid evidence-based approaches to that disorder. But what I found is that I call it the rule of threes. I feel like there's about a third of the families that I've seen have probably said, I'm just not really interested in that. Thank you very much. My son is doing fine on the Ritalin, and frankly, these sound a little expensive too. It's not something that we want to do, although I should say insurance does cover most of these things. Sometimes when we go outside of pharmacies, it's because I'm recommending supplements that, in my opinion, are actually better supplements, based on what I've learned about some of these supplements. But anyways, so there's a third that struggle with it and say, no, it's not really for us. And there's a third that are right on board, and I give them literature, we talk about it, and they're engaged pretty much from the get-go and say, yes, we like this idea, we'd like to add some magnesium to his regimen and see how he does. We'd like to add some B6, and so that's a solid group. There's another third that's kind of, just give me all whatever you can, and I don't want to take any more medicine, and it's like, well, okay, got to reel them in. But there's a third that kind of go hog wild over it, and I don't want that. I don't want people saying, well, great, does that mean I can stop my antidepressant? No, that's not what this is about, So anyways, I'd say, I don't have the exact numbers, but I think there's probably about 70 families that we've talked about this, that I've talked about this with, and I'd say somewhere in the 20s, about maybe a quarter or a third of those have kind of signed on to a program of integrative medicine and are supplementing their child's regimen with alternatives, with supplements usually. Yeah. So it's been people have been very receptive, and I've seen improvements. Supplements take a while to work. It's not like, for example, there are some, well, I guess an extreme example would be if you're unfortunately having a psychotic episode and I give you an antipsychotic, hopefully you're going to get better in days.
Yes.
Maybe hours. Whole different mechanism of action. These tend to take a long time, months often, to get the system back in homeostasis, to get things so they're balanced. So people have to understand that. Along with this, there's a field that's becoming really big in psychiatry and general medicine called epigenetics. And epigenetics is basically, it's simply, well, not simply, but what we do, what we eat, the impact of our environment can affect our genes. Okay, you say, well, I guess that makes sense. But what's important about that is it used to be, okay, here's your DNA. Ooh, doesn't look good. Good luck. This is what you're stuck with. We now know that, okay, these are the genes you got. We can change those genes. Those genes and the way those genes function can actually be changed by what you eat, what you do. It can also be changed in a bad way, too. You think about all the toxins out there, glyphosate and all that stuff,
Yes.
which can change the DNA in a bad way.
Yes,
Yeah.
right.
But the important thing is, and I think this is wonderful and hugely important, is we can change our genetic structure with what we eat, what we do, tons of things. Yeah, so that's pretty exciting.
And isn't it something that,
Yeah.
what it all comes back to is some of the things we've been talking about for many years, which is truly what you eat.
Yeah.
Do you exercise? All of these things and how they wrap around you and make you who you are. I think you have been known to say that, a lot of people who are very moderately depressed, the answer to that might be exercise, period. But that person may not have exercised in the last 10 years or whatever, so of course they're looking maybe for the magic pill or whatever that's going to change things. But I guess what I'm saying is with a lot of what you're saying, it's that whole environment on people and what kind of environment are they in and how do they deal with it, and that's fascinating as to how you can actually change.
Absolutely.
Even if you look at the DNA makeup and you say, boy, I'm kind of prone to go in this path or that path, but they might be able to modify and change that.
You can modify. Hugely important. Look at medicine. Well, a simple, good example would be diabetes. Okay. Okay. So you inherit. Let's just say you inherited that gene for diabetes. Well, that's probably not too good, but you can change that.
Yeah.
And you can change how that gene works and how things operate. Fascinating. I guess we sort of knew that, but it's a real field now, and it's really becoming important.
So we've talked a little bit about medications and what have you, but would you clarify why only using prescription medications to address mental health disorders isn't really the long-term answer for a lot of individuals?
So, yeah, there was a book over, I don't know how long, maybe 10 years ago, I don't know. Robert Whitaker, who's a psychologist, wrote a very important book called The Anatomy of an Epidemic. And in that, he looked at the pharmaceutical industry, big pharma. He looked at some of our theories on depression and how these medications work, or how we assumed that they worked.
Yes.
And really came up with some challenging ideas. And at first, I'm saying 10 years ago, I don't know when it was, but back when I read that book, I said, this is hogwash. Because back then, I was thinking, no, we know how these drugs work. We have some wonderful drugs. They're great tools. We're helping people and all that. As we've gone along in time and I look back at that book, I say, he might have been right on here. Certainly was right on about big pharma. If we have more access to drugs than ever before, why do we have more people ill? Why is that? We have, I think, 11, 12% of the population is on of the world is on psychotropic medication. That's kind of scary.
Big number. Yeah, big number.
Here's some bigger numbers. 10,000 toddlers under the age of 3 are on stimulants.
10,000.
10,000. I got this information from a lecture Dr. Kelly Brogan gave. She's one of the pioneers in integrative medicine. I often steal her numbers and some of her things. That's huge. Here's a bigger one. 8,000% increase in children up to 19 years old diagnosed with bipolar disorder.
Wow.
Huge. Why is that? Well,
Right.
big pharma.
Yeah.
Big pharma. Pharmaceutical companies came out with all these medications. Oh, look, here's medications that you can use for, and it just got out of control, out of control. So now I'm feeling like, and also we are one of three countries, I don't know what the other two are, but we are one of 3 countries that allows direct to consumer advertisement. Where else can you get an ad on the TV,
Sure, yeah.
take this pill, you'll feel better, your life will change.
Yeah.
In your living room. That doesn't happen everywhere.
Yeah,
It happens
right.
in this country.
Right.
And people are vulnerable to that stuff. So,
Mm-hmm.
yeah. So I think kind of what it all boils down to in a way is, if you're 35 years old, you're overweight, you're not sleeping, you're bloated, you've got hair loss, you're cold intolerant, you don't have any energy. First thing I'm thinking about is, could you be hypothyroid? I'm not thinking you need some Zoloft right now. We might give you some Zoloft, to help with your depression if you need it, but we're not going to just do that. We need to look and see what else. We need to check out your thyroid, which we would do. So, it's depression isn't. It can't just be fixed with medications. I guess that's one of the.
That's the parting word, so to speak.
Yeah.
Well, Doctor, we could sit here all day and talk about this
Yeah.
exciting new initiative, but our time is up.
Yep. Well, thank you very much.
So I want to thank my guest, Dr. David Mooney, for sharing his insights on the benefits of the new NCSS Integrative Medicine Clinic, which opens on October the 1st. Now, before we go, it's time for the NCSS Factoid of the Month. Even though the month of September serves as Suicide Prevention Awareness Month, at NCSS, we want to make certain that this topic is in the forefront 24 hours a day, 7 days a week, 365 days a year. Among the many specialty services made available to the community, NCSS offers prevention programs by facilitating mental health first aid and youth mental health first aid trainings. In addition, we have adolescent services, community services, outpatient, crisis, and mobile crisis available in your time of need. NCSS provides confidential services and programs to individuals struggling with suicidal thoughts. NCSS is here for you with services to assist if you or someone you know is struggling with suicidal thoughts. You can call our crisis line at 524-6554. NCSS, you may not know us until you need us. I also want to thank you, the viewer, for spending time with us again this month. You can learn more about the NCSS Integrative Medicine Clinic and all of the programs and services by heading to ncssinc.org. I'm Joe Halco, and I'll be back next month with another episode of NCSS Here for You.